Today, we are lucky to talk to Jaimy Voigts, doctor of chiropractic, who not only had her own breech vaginal birth, but is a fellow BRF and a huge advocate for breech birth. Jaimy, introduce yourself and lead us along our journey.
Thanks for having me. Super excited, passionate about Breech and for people to know what our options are or not. So my oldest, she's 15 and a half, was breached and we found out late. So I did all the things I was supposed to do. I got adopted in my pregnancy. I was going to yoga, getting acupuncture, doing all the things and planning to give birth at a birth center. There are rules or restrictions around that in terms of the type of birth you could have. Breech birth is an automatic risk out. No breech babies at a birth center in Colorado. At my 37-week appointment, everything looked good. Baby was tied down, and we were a go. My 38-week appointment, I saw a different midwife. I was not convinced what she felt was ahead. I had never met her. I didn't think she knew what she was talking about. So I did go get an ultrasound, and she was correct. My daughter was frank breached. Fortunately, we had an OB that had a very good relationship with the birth center. And so they called his office. He was like, yep, come. Yeah, I saw him the next day. I was 38 and 2. I went in with a bag packed. I thought, okay, he's going to want to do a version. He did a quick ultrasound and felt, and he's like, yeah, no, you're not a candidate for a version. This baby is so low. I couldn't tell its gender. He's like, let's get you evaluated for breech birth. It didn't cross my mind to be scared or ask about the risk. I wasn't giving birth at the birth center. I didn't want to be in a hospital.
It was devastating. I definitely had my meltdown over it, sobbing, crying. Yeah, it's really hard, especially because you have a very unmedicalized pregnancy from what you've said.
Yeah.
Those years is it's
a huge shift in a short amount of time. I'm fortunate I didn't have a provider who was immediately like, we're scheduling your C-section and not willing to have a conversation about it. For this OB, breech is a variation of normal. He's experienced, no fear around it. There are requirements, head to abdomen ratio, baby's position. We tick all those boxes. It's like, you're a great candidate for breech birth, so go home and try to go into labor. I was pissed. This was not the plan. I thought I was in charge. I was going to manifest things the way I wanted. I spent the next week trying to train this baby. I got adjusted every day for 7 or 8 days. As a chiropractor, I have friends I can call. I saw a birth intuitive. I called my hypnobirthing instructor. I got the breech script. I had a massage therapist, and she did my abdominal freshen. I was throwing everything at it. 39 weeks, my second appointment with this doctor. He's like, why are we not in labor? I was like, well, I'm waiting for her to turn. He was like, oh, no, she's not going to turn. We didn't know it was a girl. This baby is not going to turn. And so I think at that moment, I was like, all right, now I have to shift gears. No energy toward turning, except I'm having this baby in a hospital. This isn't exactly how I thought things were going to go, but things need to go this way because he was scheduled to go out of town. There were no other breech supportive providers, not that I was aware of. I came to find out later there was another one. I had called all the home birth midwives. Home birth midwives in Colorado were now allowed to catch breech babies. I had no other options. So
painful because of midwife. If boys going to have significantly more experience, you could ask breech birth than an OBM.
In Minnesota, midwives can catch breech babies. The challenge is that everything is the same from state to state, hospital to hospital. I feel fortunate. I had knowledge, access to resources. I immediately had options. I didn't realize how limited everyone's options were because I was in this bubble where this is what I do. I had this close working relationship with this birth center, this midwifery practice, doulas. That's where most of my patients were coming from. So they were having a similar experience to me in, having some emotions around risking out, but also immediately being presented with, here are your options. And I had patients who had ECBs, some were successful, some weren't. That's where I started additional research after my daughter was born, trying to figure out why she's there. The birth intuitive I saw was interesting. I was already working at the office I now own. I have friends that opened this pregnancy business. There were 30 of us loosely associated with this business. So again, built-in resource. And they're like, you need to go see this woman. And she was like, why do you think this baby's breech? I'm like, well, they're right, yeah. Like, my takeaway from that session, she's like, well, tell me about yourself. What do you do? And she's like, oh, well, that's why. I'm like, well, what's why? She's like, this is your journey. It gave me a unique perspective to educate and support hundreds of women over the last 15 years, a very similar experience, and provide them with information resources that they're not getting elsewhere, they don't know how to access, or is straight up being withheld from them because it's not the agenda by the provider whose care they're under.
And so it was so hard to hear everything happens for a reason. Like in the middle of like chaos or an event, that's still a thing that someone wants to hear, but that is how it always works out. Like you're always able to look back
Yeah.
and
And I think
understand.
she would absolutely, she was careful about the language because if she had said everything happens for a reason, I would have laughed.
Yeah.
But she was like, oh, that is why you are here. This is an important part of your journey because of who you are and what you do. And at the time, I was kind of like, well, that's yes, I'm pretty sure I could still do my job decently. Having to go through it myself. And then even looking at the birth itself, I view it as a positive experience, even though it was so dramatically different from what I had planned. It was given options, listened to by providers. The OB that I saw was very candid. Like, he did have a good bedside manner, but she was also very candid. This is not going to be the birth you envisioned. You have to give birth in the OR. You have to lay on your back. There's going to be purple pushing. High likelihood of episiotomy. He laid it all out, but I would rather have had it given to me as like, so here's the way this is likely to go. The reason you're in the OR is in case we need to put you under general anesthesia. You're on your back because breech babies need medical support, and that's the best place to pass this baby to the pediatric team. I don't like it, but I guess this is how this is going to go. One of the things I regularly tell patients, and you have to feel out who can receive it. Yeah. And when is that there is a distinct advantage to knowing that your birth is likely to end in a C-section before labor. I was able to process those emotions.
Models, I'm landing.
Yep.
Hey, cascade of interventions here. Like,
Yep.
is okay. Yep. Need an epidural on Pitocin. It is not normal. Yeah. Nice to be experiencing 300 times the normal.
We're built for that.
You know, like, I agree. Like,
yes.
And you're right. Like, there is a feeling out that has to be done with certain information because some people just are not ready to hear.
Yeah.
Route.
And even the language around it, right? Like, I have a lot of patients who come into the office and they are either in the anger or the grief phase. And I'm like, all of these emotions are valid, right? Like, you can be happy that you have a healthy baby that made it to term and also be really pissed off that you don't get to give birth where you want to or how you wanted to or how you planned for or all the work that you did to get to this point feels. So, holding space for them and the emotions that they're feeling and validating those emotions is huge. Being able to go through the anger sad between risking out at 38 weeks and giving birth 13 days later. So lots of emotion tough. But I had a sense of how my birth was going to go. I still at no point entertained the possibility of a C-section. I was like, no, not going to. I'm a manifesting generator. So I was like, no, it's not going to happen. But being able to experience those emotions prior to birth is a lot different. I went into the birth center in labor, transferred. Now I'm trying to process emotions while trying to figure out how to breastfeed. Can't get out of bed because I'm 4th degree tear. Holy moly, I'd rather give birth again than try to poop. All the hormones and emotion. People go through a lot of emotion and process possibilities when given this information in a short time. But always emotional. Most are angry. They're not that their baby isn't head down. They're not angry that they're now facing a C-section. They're angry that nobody said anything until that day about baby's position or the fact that that position would dictate their birth pattern. So back, I'll backtrack to my birth. Like, I mean, it went for me.
How long after you accepted that there was no turning this baby, that was not the focus, did you go into labor?
1 week. So my first visit with him was on a Friday. Her due date was on a Friday. I fudged because the highest likelihood risk out of the birth center was 42 weeks. Like statistically, first baby, about a couple of days. By my count, she was 5 days late. By their count, 1 day early. I saw him twice before labor. I went in right at 39 weeks on a Friday. It was my second visit. And he was like, "What are we waiting for?" I said, "I'm waiting for the baby to sure." He's like, "That's not going to happen." My husband's response was, "She's waiting for her mom." I was like, "You're going to go the day after my due date." I wanted her there as long as possible after my daughter was born. And he was like, "Can she get here earlier?" Like, "I don't know, we'll call her." She dropped everything and was out by Sunday. She cooked me breakfast every morning and drove me to my appointment. It was lovely.
Weekend before my first daughter was born, my grandmother helped me nest. We got the nursery ready. My husband was scared of us. He was like, "I'm not going upstairs because every time I go upstairs, there's 2 of you and you give me something to do."
I always say my mom is like a little house elf. She's always busy cleaning or folding, always productive. But my husband appreciates when she's here because things are just, the household is running more smoothly without more output from him.
Yeah.
But like, I look at that time now, it's a gift. The most time we had spent together since college. We spent today making the online recipe for eggplant parmesan that guarantees you'll have your baby. I woke up early, like 4 or 5 a.m. and I had a contraction. It was different. It was just different. Like, I should probably try to go back to bed. So I did. My husband got up and went to work. I kind of woke up and was like, "I think I'm having contractions." I was like, "What do you mean to do?" "Go to work. I'll let you know." They increased in intensity. Time in between was reducing. I got in the bathtub. I called my doula. She's like, "Oh my God, get out, go for a walk." It's not great to stay in the bathtub.
I worked in a birth center where the midwife does not let you get into the bathtub until you, what she says is like pissed off.
Well, but I had a lot of sacral discomfort. I was pushing. They were trying to get her heartbeat at the top of my abdomen. The only part I would describe as pain is intense sacral pressure. I just wanted heat on my back. Went for a walk around the block. My mom, 4'9", my husband, 6'6". Wiener dog, dachshund, by about 3:30 in the afternoon. I was about 11 hours in from the first contraction. I was convinced was labor. Couldn't talk through contractions anymore. About 3 minutes apart, probably a little closer than they were supposed to be. But it just like I recall it being more like 5 because they wanted more monitoring because of her position. I didn't want to go to the hospital. I had accepted it, but didn't want to go. Between my mom and my husband, we have to go. It's about 20 to 25 minutes with no traffic, approaching rush hour. We need to go. I finally caved and I was like, "Yeah, fine, let's go." We get into the car. I had the car seat installed by the fire department. My mom is in the back with the car seat and I'm in the front. Worst idea ever. I'm constantly changing positions, facing the window, the back. My husband, "Put your seatbelt on, like drive faster." Worst part of my labor. We got there. I had done hypnobirthing. I had a friend who was a doula, who was my main doula, and I had another friend who was my backup doula. Because I was like, "I'm going to need you both there. We're going to have a battle on our hands. I need as many support people in my corner," right? The first one was like, "I'll meet you at the hospital. I'm going to be a while." The other doula was teaching a childbirth class. I got there. Even though I pre-registered, the girl in reception had clearly never seen a woman in labor before. She spelled my name wrong, got my birth date wrong, screwed everything up. Get to the room. First time I remember him coming into the room, wanted to do a check. The nurse came in and was like, "Is he going to recheck?" She was like, "Yeah." I was like, "Then no. I don't need 2 sets of hands in there. You want to take your word for it. Thank you." And I was about 5 centimeters, definitely in active labor. I don't know if I was talking through contractions, but I comfortable in between. They wanted that extra monitor to work, and I don't think they got a decent strip because I could not sit still. I had to keep moving because of the sacral discomfort. Things moved quickly after that. I kept using the excuse of the bathroom to get off the monitor. I have no recollection of being checked between 5 and 9.5. They would get that for 10. It was about an hour and a half, but it felt like 10 or 15 minutes. Like, he came in on the toilet grunting. He was like, "Stop pushing." And he looks at my head. He's like, "Get her up." Like, lifted me up, got to the bed, and he checked, "You're 9 3/4. Stop pushing." I had to be transferred to the OR. Hospital policy required that I delivered in the OR. So just, my husband had him.
You have to do the car ride to the hospital.
I was in full labor land. I'm pretty sure I could have flipped it all forward. It was about a half an hour from the decision to move into the OR until 3. I have to ask my husband because she was born. So my timing,
once we went treated that as an emergency,
sure.
10 minutes when they get you back.
One of my concerns going to the hospital, they dealt with transfers out of the birth center. When patients who want to be in a hospital, midwives and nurses familiar with unmedicated birth go to this hospital, they've seen more. I'm worried about the nurses, but this is the only hospital where he's catching babies. Some nurses wanted them to see that. It was chaotic in that transfer, wheeling me to the OR.
Well, my mom and got to have
and his workers. Yep. And so, I mean, he was great. He pulled her in. The workers' contraction was getting from the labor room to the OR because nobody was giving me sacral counter pressure. I was like, yeah, the nurse behind me, I was grabbing her arm. It was so intense. I remember little because I had an anesthesiologist here who was just running at the bit to knock me out. My husband finally was like, "You need to shut up," to her. This coordinator was apologizing to me. I was grunting. But these are sounds we make in birth. She had no idea. She was like, "You're wasting energy making noise. Stop making noise." Finally, my husband was like, "Either shut up or go away." He was like, "Yeah." I had tuned her out. The nurse in front was so sweet. She had the Doppler trying to get her heartbeat through her head. So right at the top of my belly, from my uterus, it was so painful. I remember looking at her and be like, "That hurts so bad." She's like, "I know, I'm really sorry." I'm like, that's the worst pain I have right now. I do not remember pain sensations of her body hitting my body because the pain from that pressure of that Doppler was so intense. You can have 15 people observe the same situation and everybody's experience is different. It's true in birth. I was on my back. My husband had one knee, a nurse had the other. I remember making eye contact with the doctor and her body coming out. Years later, it occurred to me to ask, they still come out face down, but first. I didn't think about that until years later. Wait, was it no? Butt came out, then leg, towards the pause for the head. In that pause, I don't remember if I was pushing or waiting. He was like, "We need to keep going, not wait for a contraction." My recollection of that is him making eye contact with me and be like, "This is the last contraction. I need you to push as hard as you can. If she does not come out now, we are going to have to switch gears." My heart rate skyrocketed and hers had tanked, is what my husband and my mom were able to share with me afterwards. And so there was this sense of urgency on his part, but also I did not feel like he was panicking. I had no sense of panic. I was like, "Yeah, this is cool." So came out. I did get an episiotomy for that, but he let me know beforehand. I had given consent. I knew it was a possibility and I didn't feel it. So, afterwards he was like, "All right, I'm going to give you a shot of Pitocin." I was like, "Why?" I had nothing up to this point. I didn't take fluids. He's like, "We just do this to stop the bleeding." I was like, "Am I bleeding that much?" And he was like, "Nah." I'm like, "Okay, can we not then?" He was like, "Sure, we'll wait." He's like, "I am going to give you anesthesia though, because I need to do stitches." I was like, "Did I tear?" And swivel around, look at me. I had no idea. 4th-degree tear. There was an episiotomy. You don't really get those without an episiotomy. The shot for the anesthesia, terrible. Seeing burns. She was sewing. I stopped at one point. Trying to remember the time from when she was born until I delivered the placenta. It was quick. After I don't know, like when you deliver the placenta, you feel like pushing a regular push. I pushed once, maybe twice. I remember him holding it up, making sure it was there. Come to find out later, it was 3 to 4 times the size of a normal placenta.
That is so interesting. I was at work one time and the placenta broke the hospital record. It was an 11-pound baby and a 6-pound placenta.
encapsulated 15 and a half years ago. I do hold on to him for menopause. I was like, don't let him take it away. I'm putting it in the cooler. I'm taking it home. It wasn't as common as now.
And finally, looking after 15 years ago, like, what the hell is
I didn't all these like she's running an unmedicated breech baby. Clearly, she's a lunatic. So just add this to the list. They did an inspection, put it away, finished stitching, back in the recovery room. Once that anesthesia wore off, holy moly, it was hard to get out of bed. So my goal was like leave immediately. She was born at 7 p.m. He's like, I need you to stay overnight. Hospital's not going to release her. She did great. Prepared for this blue floppy baby that would be whisked off. She came out red, screaming. Her head comes out and pulled her up and we made eye contact. What just happened? They did take her over, quick heart rate and all of that. Sometimes breech babies need help, but she was great. They wanted to take her to the nursery. I'm like, why? So a bit of argument with the nursing staff of like her temperature. I was like, yeah, no, she's in the warmer. One of the midwives, Julia, and the midwife showed up at 7:30 and walked like, you already had the baby? It's the midwife was there to help with that first latch, which longer than I wanted, but it still happened within an hour. Once I told the nursing staff, you're not taking her. You can keep checking on her, bring me a warm blanket, do whatever you want. You're not taking her out of this room. I refused to let her out of my sight. We did finally consent to giving her a bath because nobody warned me about frank breech babies. They will poop. I remember being transferred from one bed to the other and being, then I pooped and labor and like, now that was the baby. She came out and pooped right away with every contraction. It's being poop out of I don't like most pressure is on their everything is generating down. Lost my train of thought. That's all right.
It happens to do a bath.
We thought she was born with freckles. They were not freckles. It was poop. See, I was like,
I believe for a nickname around that.
Not specifically, but like I remember people being like, was she stubborn? I'm like, no, she's actually not stubborn. She does, however, have her own way of doing things. And it is pretty much always opposite of how I would do it.
No.
You know. But he came in the next morning and was like, I will release you today. My daughter had already seen the pediatrician. She had been released. I had already with a practice and let them know. My goal was to leave as soon as possible. So she was released by the pediatrician. He's like, I would recommend you stay until this evening. Just see how you're feeling. And by the end of the day, like, I'm like, I can't get out of this hospital bed. Then how am I getting out of bed at home? Mobility was the biggest issue with the stitches. Home next day, she did great. We did a 6-week ultrasound. She passed with flying colors. I just felt I had choices that I was in control, even though there really wasn't a choice about it. But I was educated of why things needed to happen the way that they needed to happen.
Because and that made the important part.
It made all the difference. Did you feel you were making informed, empowered decisions?
If you had risked out and they would have gone to a provider who said, here's your C-section date. Your free things, show up, have a C-section. It's not what you wanted. It's a completely different experience.
The average person in the situation does not have the background or confidence in our body's ability to give birth. My viewpoint is unique, and I feel comfortable advocating for myself.
With my second daughter, I've had to advocate to get my 36-week C-section.
Yeah.
But I am, because of ICP, I'm on, or was on, the board of ICP care. I know more about ICP than the average woman. We shouldn't have to be so educated to advocate for ourselves.
Make a rational, objective decision instead of a fear-based decision. Many people, that's the situation, even the language around breech and different options. Patients come in, they're like, Mario B said the ECD isn't safe. But they told you a C-section was like, yeah, don't even think twice, sign me up. Because now we've already colored that perspective. Support every patient regardless of their goals. It's the last question on my intake form because I am here to help you meet your goals. While I'm a huge advocate for natural birth, unmedicated birth, vaginal birth, if you don't feel comfortable based on the information you've gathered, I will absolutely support that. But so many people, their perception has already been colored by the language and the attitude of the providers who have educated them before me, anybody they came before me. So, and some people, they're like, if I'm C-section, it's fine. I'm going to try this first. I'm like, great, let me educate you, and here's what you could do at home, right? And other people are, I think they're trying to convince themselves of that because it's what the provider side or what their partner expects. For my husband's family, there was a complete lack of support for out-of-hospital birth from day one. It established woman care and done TC stuff with the midwifery practice in the birth center before I got pregnant. So I was like, what do you mean you're not going to see an OB? And I'm like, if I need to, I will. But if I have a low risk pregnancy, that's just not necessary. I couldn't wrap their heads around it. When I risked out, they were happy I would be giving birth in a hospital because that's what felt safe and normal to them.
I love that your husband was such a fantastic advocate.
We joke a lot. I have a strong personality. We complement each other. When he feels strongly about something, he is absolutely going to speak up. Knows that I usually feel more when he's like, respect that because you rarely put your foot to this. This is why we have 2 children, not 3.
Because that's where we're at.
It's a good balance. Must threaten me. I just don't care. If I care, I'm going to say something.
I care about the small thing, and he cares about the big things.
That we might be married to the same person. I would have gone for home birth the first time. He only has familiarity with hospital birth. So the birth cell is kind of a happy medium for both of us. It was great. The hospital wasn't what I wanted, but I look back and think of it as a positive birth experience. And so I think, I don't know, but it is a challenge. And I think doulas often run into this as well. There are so many things that have already been decided before the patient or client gets to you. And so when somebody's coming to me at 36 weeks, I'm not going to be like, somebody should have checked your baby's position 2 weeks ago or a month ago. There's no room for shame in that.
You thought you were doing the right things. Pregnant. I have hypermobile healers with my daughter. I thought keeping up a regular yoga practice, regular Pilates, like things like that were benefiting me, when in reality, that was the opposite type of movement I should have been doing.
It depends on how you do that movement, right?
As the RN pros, we approach things differently and we take things into account that other people may not. So yeah, it's frustrating when someone comes at 36 weeks. We couldn't have addressed this months ago.
As a doula, it's different. I am involved and invested up until birth, but I'm not present for birth. For BRN pros, present for birth, whether as a midwife or doula. I think one of the unique things about BRM is this individualized assessment. Everybody whose baby is breech, I send them to spinning babies. This is the most concise place, a list of things to do and feel a sense of control.
When you're out to be happening to your babies,
go home and do this. No guarantees, but people, I want to know that I've done everything I can do. We're in this unique situation to have this individualized assessment, not like walking is good for inducing labor. If you have an anterior tilt, you should have been doing this, or we would encourage you to start doing this at 28 weeks. We're not trying to get rid of 15 years of tension in 6 hours.
My goal is to help you have the most boring births. I know what to do for easy stuff in labor because you didn't work on position beforehand. How do you feel your practice changed after your breech birth in regards to chiropractic?
I think the universe listens and provides this like huge influx afterwards. There is so much opportunity to share. You try not to overshare. I asked the midwives to train me in Leopold because the chiropractors are not trained in that. It is not part of Webster training or assessment. It is a gray area in terms of scope because there are other people checking that aren't OBs. We're not trying to manipulate baby's position. But if you're seeing me 2 or 3 times a week for an adjustment to get this baby create more space and encourage the baby to go head down, then the likelihood that I notice a positional change is much higher than your midwife or OB that you maybe are not going to see for 2 weeks. Once that baby has gone head down, we want to shift gears. Now we're going from, get them up high and yeah, yes, continue to release the tissues that need it, but bring gravity into the picture. We want this baby to get down. There are important aspects to cranial molding. The more time we have, the better. To go back to how it changed. Yeah. So I think I started trying to be more aware of position and through my own body. Maybe the placenta was so big. I can't believe this woman didn't say anything to me. So she handed me a jar that had 250 capsules in it.
That's crazy.
And I didn't know. I had never had a placenta. I didn't know. I was like, oh, it's like it's jar vitamin.
I mean, this isn't like a clinical number, but to me, the average I see is 60 to 90.
When I got my placenta back with my second, I was like, where are the rest of my pill? She was like, what do you mean? And I was like, well, I got 250 with my first. She was like, how many babies did you ever heard of? I'm like, just 1 7-pound baby. She's like, oh my gosh. So I had gone back to that OB for birth control at some point. I was like, bucket away. I know you still have my record. Why I was going on with my placenta. He looked back at the man said, multilobulated placenta. I've never seen anything like it. He told me if the placenta was that big, it would explain my narcolepsy in my first trimester. I was so exhausted. I couldn't function for the fatigue growing that placenta. That could have been it, right? It was in the way by the time she was ready to turn and there was nowhere to go. I now know, doing research, PTs, OTs, chiropractors, you have a higher percentage of breech babies because our work is very physical.
Working with chiropractors my whole life. They spend a lot of time on their knees. They still slow, they're sober.
Almost all of us spend 90% of our time working from one side of the table. There's a lot of asymmetry.
One of my friends, who was also a doula in my second pregnancy, she's a PT, and her first baby was a surprise for Breech.
Yep. I have an OT in my practice now who at 34 baby's head down. It is more common, and it's both the asymmetry, the repetitive asymmetry of our work and learning proper technique to protect our bodies. Fencer stance is common. I didn't realize I was doing it because it had become second nature. I primarily utilize a drop table, but even if you're doing diversified, when you go to actually deliver the adjustment, you contract your core. That's how you protect your body. Once I got pregnant, I can feel that happening thousands of times a day. I was also a runner. I started in 4th grade through my sophomore year of college. A whole lot of foot so just a lot of tension in my body, a lot of asymmetry. I started exploring this and looking for patterns in other patients and really started talking to runners, body workers, trying to educate them on let's work on this now. Trying to put a puzzle pieces together. It's a detective work. You have to come into every person from a place of curiosity and try to figure out the unique puzzle that is their body. We can have the same parts, but how we use them, our routine, trauma, all of that is different. That is what's so unique about BRM and individualized assessment to create movement and tools. And what do you do day to day for it to be preventive? I mean, that's what got me into chiropractic, the possibility of preventive care. Why did I want to wait until patients were sick and then give them meds or perform surgery when I can play a role in this person's healthcare team and hopefully prevent them from needing those things, leading a healthy lifestyle, feeling good in your body? The things you do are helping your body to heal instead of masking symptoms, whether as a chiropractor, body worker, doula, a yoga teacher, it doesn't matter. If you have access to a pregnant body before labor, you have a unique opportunity to provide them with tools that are going to increase the likelihood that they have positive birth outcome. That doesn't mean a medicated birth. It doesn't mean they don't have a C-section. It means they're tuned into their body, listening to their body, able to advocate for themselves. They start learning language that helps them communicate better with their healthcare team. Those contribute to the positive birth outcome. That's universal breech or not. I was introduced to Lindy through Lauren O'Hagan from Restore Your Core. I was searching for some additional tools to support my postpartum patients, especially. Came across RYC. I did the teacher training with Lauren because I was so impressed with just her depth of knowledge around how our body works. She has a unique ability to watch a body move and quickly zero in, like, okay, here's the hang up is. It's where we need to move a little more, we need to move a little less. And she can quickly give that percentual to create immediate changes in their body. It's really impressive. And then, of course, because so much of my practice is pregnancy, I was like, wait, you also have a prenatal program? That I was like, who's this woman? Going down that rabbit hole, I had taken Carol Phillips courses, was familiar with spinning babies. It all just comes together. What I loved about the BRM training was a change in perspective to start thinking more consistently about birth. I had ways to assess that alignment and movement, orthopedic exams, range of motion. That's always been part of my examination. Instead of just thinking about, okay, we're going to go through a Webster adjustment and we're going to release the psoas and what really now feels like a very simplified treatment, that all these other tissues are also impacted. I'm not just going to release your QL on this right side because it feels tight or you're experiencing pain over here, but I know that it's going to be harder for me to get their head engaged into your pelvic inlet from the correct angle because there's QL tension on your right side, impacting pelvic mobility. Started thinking differently about
what is causing the QL tension. What
body
is misaligned?
Sometimes, I don't know if this is a Lauren or a Lindsay thing, because they do have a lot of things in common in the way that they teach. But that was something I started incorporating more with Lauren, thinking about how we move every day. As a chiropractor, I can adjust you, release a joint, I can realign a joint, I can release muscle tension, I can release fascial tension, but then you're going to leave here. And if you don't change anything about what you do when you leave here, you're going to come back to a very similar state. Yes, I might get plaque from some chiropractors for saying this, but I am not of the philosophy that you need to be adjusted 3 times a week for life. I want to see change happen quickly and be maintained, not by my hand. I want people to lead with tools. Some people show up and they want me to fix it. I'm like, so we're a team. I can't do this alone. Most people want exercise or stretches, guidance. How is this impacting your life? These are the places they're most motivated to make changes. Giving them tools how to do this so you don't experience pain when you do it. But that is also usually the best way economically. It's where their core is able to fire, not straining joints and tissues. Even if the long-term goal is we get this body ready to give birth to a baby, the short-term can be less pain. We've made modifications to daily life, right? These pattern, habit, repetitive movement have gotten them where they are. Some are obvious, some of them are tricky, and some of them you don't figure until 4 to 5 weeks in when somebody's like, I figured it out, made that pain happen. I'm like, why are you doing so? Nothing that ever crossed my mind. We can't know everything with people, but one of the first things I ask is to raise your level of awareness of how you move and use your body through the day. I want them to tune in. Pregnancy is a unique time to connect with your core and your pelvic floor because these tissues are changing.
Yes. But I also work, your brain is listening. That genuinely have zero connection to their pelvic floor.
For a lot of them, it's trauma. Culture, trauma. Many cultures where women are still dirty, has to cover, hide, it's still pervasive. It starts young girls, 8, 9 years old, sucking their bellies in. I don't even know if they know why they're doing it. We are starting to change the dynamics of our core function and the responsiveness of our diaphragm and pelvic floor before puberty. For some, they're huge. Going to the BRM training, the first portion, like the anatomy stuff, was a breeze. I was like, oh, this is great. We're going to allow this. Yeah, but then, you get a lot of doulas or movement instructors or other people who are not at all in, kind of a medical or healthcare field. And that was really overwhelming. And I'm like, it's pretty easy to get overwhelmed with all this information. It can get easy in trying to do an assessment. So many things. It can get overwhelming. One of the yoga instructors on my team went through the BRM training with me, where yoga instructors on my team is going through the RYC training now. you start to see one or two things, like their ribs are thrusted or their feet are far out. Start with that. Small changes build. Every day body is implementing that change. We are putting less tension, less strain. Their nervous system is less inclined to be fried because your body is trying to compensate for whatever pattern we've created. It's hard. I get jealous when people are like, terrible hour to do a BRMS. I'm also trying to do chiropractic stuff. Sometimes it's hard. There's so much to work on. Offered, it can be hard to pick the right movement or tool. The more you look at bodies, the more you, I mean, if anybody has left that training and isn't, there's not as much gait stuff in BRM. ROAC has a decent amount of gait stuff, and yoga instructor was like, I'm just looking at butts all day. I'm like, welcome to the world. It's hard to not be what the pattern in moving the body means once you really start looking.
I'll be at Target and I'll like be these. I'll look at I just want to be like, oh my gosh, I never heard so much feeding you have doxy until it looks so both.
If you're not in pain, your brain is not well connected to that part of your body. My oldest runs cross country, and as a runner, it is painful to stand on the sideline and watch these runners and be like, oh no, your left hip doesn't extend and you're pronating on the left. I just wanted to jump in and help. Everyone's journey is unique. When you get involved in the birth world, I think that's one of the things that is going to separate us from their birth care provider is the ability to treat them as an individual through a physical assessment, whether that's through, providing education, whether it's support of like, so here's this other network of people you didn't know you had access to. It's an easier and a harder part of my job. I see conversations in Facebook groups about breech specifically. People are like, try chiropractic acupuncture, spinning baby. Other people are like, that baby's breech for a reason. Just have your baby. That's not an option for most. A sense of panic and lack of choices.
15 years later, what are the biggest obstacles or misconceptions in your patients in regard to their care lines to breech birth?
Lack of options, for one. The two older gentlemen supporting vaginal breech birth, they both retired. One moved out of state, did on-call hours, now moved back, but just on the same capacity. You can't support as many people. You can't be on call 7 days a week. There are rumors, if it's not your first baby and you show up in labor at hospitals, they might let you. I know people who had PPS called on them. So
where,
but essentially,
as a patient, as a patient, you always have the right to refuse surgery. That is a federally protected between times. You do not want a breech baby with a provider not trained in breech birth. That is yet interest.
For the patients showing interest or asking about breech birth, like, what are my options and why can't my OB just deliver this baby? You can ask if they or anyone on the team are comfortable supporting a breech birth. The answer is probably no. It's a variation of normal and it happens all over the world. Most OBs these days are not trained. There are nuances and differences. If they've never been trained in breech birth and they've never attended a breech birth, that's not your safest option. Your safest option with that doctor is a C-section because that's what they're trained in, experienced in, and the lowest risk option for you. And some people are committed to staying with their doctor, but that is the priority. A C-section is your best option with them. You need to ask them what those options are.
Unfortunately, the choices have consequences. With your doctor.
Dissatisfaction with how things were handled. If interested in vaginal breech birth, I can refer to a supportive provider. Some have a bias and other people are like, oh, tell me more. Or yes, I would like that. I would like that information. There is this other option you may be interested in. Let them know they have options. That was different for me. The way that was handled, it wasn't this scary, urgent thing. It was a bummer. You can't have your baby here, but we're going to refer you across the street. He's going to take care of you. We send people to him all the time. I wish patients knew sooner with how important your baby's position is in terms of the outcome of birth. It is the biggest factor. How long your birth and how much discomfort, whether you request pain relief, so big. A lot of people don't know what normal is. They don't know head down anterior is normal. I get responses like, oh, the baby's head down. Awesome. That's half the battle.
If I have a client that gets cervical check or they're at the hospital being induced an hour method, will ask for info. A lot of times, the only info that they can relate is cervical dilation because that's what we're trying to say. We're need a room health. Ask a doctor or a nurse will say, like, okay, cool, like, grab a station, have a basement, have dilation, but then they can't tell you the position of the baby.
Yeah.
I
don't know that I've ever had a patient after birth that was not a healthcare provider who was able to relay the station of their baby at any point in labor. I don't think it's information is shared in Denver. As the doulas get more education, we see more pushback in hospitals. They're starting to tighten restrictions on what doulas can and can't do. If a doula knows more, you'll blame her. Get more education.
Weeks ago, while we birthed, the nurse themselves for mom, she did a cervical check and her station was a -3, and this is a 37-week induction. That's a good station. I've seen induction start at -5. The nurse looks at me and I was like, your baby is in the inlet. You've done the work. We're in a good spot. And the nurse goes, that's not the inlet. She's like, I've been a nurse for 28 years. That's not the inlet. She said something else and I was like, how have you been a nurse for 28 years and don't know where the inlet is? So I was like, have. And then after that, I have the charge nurse coming in and asking me for my credentials because I don't seem like I know what I'm talking about.
And this is why I can't nurse on birth. I cannot keep my mouth shut. My response would have been, that's embarrassing for you. You've been a nurse for 28 years and you don't know where the pelvic outlet is? I respect you as she bite your tongue.
She got being so rude for whole shifts that I was nice.
How is that helpful? You are to impact this patient, give her that morale boost. Why does the nurse need to educate you? Why call you out? How does it impact her?
We touched on choice of language. That nurse was not intentional in her language as a body worker. And like other people that you know that aren't doing like similar body work in certain positions all day, it affects their likelihood of having a breech baby. What are some other positional things that you've noticed between your patients that have breech babies?
So,
lifestyle, positions during the day.
There are definitely, it isn't unique to breech. We'll see it with a transverse or a baby that is, kind of completely posterior. I think anytime we are seeing a non-ideal position, a non-optimal fetal position, there's tension present, likely through the pelvic floor, frequently through the abdominal tissues. The word tension gets used a lot. The word spasm gets used a lot to describe sensation for what we may palpate under our fingers, explaining what a normal sensation versus what they feel, because high tone and actual tension in these tissues is very consistent. It may be low back. So those areas too, none of the core muscles exist in a vacuum. They're all working together. If we have dysfunction in one, we likely have elsewhere. Chiropractors and body workers, we get wrapped up in the low back glute muscles, using words like sciatica. We want you to feel comfortable. If you have high tone in your abdominal muscles, where's your baby going to go? If your pelvic floor is, if your right anterior pelvic floor is in spasm, So I think tension in tissues, that inability to soften and to yield to the baby, right? The baby's instinct is to get into what we consider optimal fetal position. It is the fastest, easiest way to get out. They have reflexes, their own system ready to respond and help them exit the body. Yeah, there are potentially obstacles. There are things, I think it was in BRM at one point where Lindsay was talking about like a whole bunch of preschoolers in a room. there's only so much physical space while this container is dynamic. If you keep putting more preschoolers and there's more chaos, make sure we have the dynamics of that space. As this baby is growing, right, the volume is increasing. This human is going to increase in size and they're taking up more space. The container has to yield, stretch, and move to contain the baby at all, right? And then we also are trying to contain this baby in a way that that baby can move, that that baby can follow their instincts. And there's nothing that's preventing that. We don't have any obstacles in the way. We don't have a tissue that cannot yield, that, there's only so much movement if they're up against a brick wall. There are ways to ensure this space remains dynamic because it changes every day. So, you can do a BRM assessment on somebody in their first trimester and identify the movement pattern. And then they're going to come back 20 weeks later, relax, and a shift in their center of gravity, and their weight has changed. And oh, by the way, I started this new job where I sit at a desk all day, and you are assessing a different body. The body is dynamic. Nothing is static. We can make positive changes, but at the same time, it's also going to keep changing, and it's very dynamic. And so, people are like, oh, they checked it, 32 weeks when the baby was head down. And anybody check for fun? Or I saw a therapist at 25 weeks, so I'm good. No. We want continuous awareness, constantly checking in. What's going on with my body? What do I feel today? Yesterday it felt good. Today's different. Let's not do that today. Let's see how it feels tomorrow. Let's do something different.
What is really frustrating is this hyper focus on weak pelvic floor. Yeah. Everyone thinks they have a weak pelvic floor and that they need to strengthen their pelvic floor. Most women are dealing with hypertonicity and torsion. Yep. From the 1 in 3 women that experience sexual abuse, are very stressful lifestyles, the fact that we sit all day, all of these things contributing. I always tell them, please do not do any kind of birth prep, do not do any kind of, especially physical exercise in pregnancy or postpartum without getting evaluated first, by a qualified medical professional.
Just to get a baseline for your normal. I ask everyone as they come in, what do you think has contributed to or caused whatever it is they're experiencing? More than 50% of people are coming into my office with a pain complaint. Number one reason is pregnancy. You've been made aware of this issue because you're pregnant, but the likelihood that it actually, the underlying things is not going to start right now because you're pregnant. There's a lot of pelvic floor and core dysfunction in society, but absolutely in women. And I don't think most people have any symptoms or awareness of those issues until pregnancy. The big part of the challenge too is there is kind of this perception from a lot of people that they either everything was perfect before they got pregnant, right? I was strong and I was fit and I was active. I can do this and I keep exercising the way I did before because it's safe. It's not putting yours or your baby's life at risk, but we can have a higher standard. What is the goal, right? You're not trying to compete a strong in a competition at 40 weeks. You're trying to help people. What is the goal here? Modify your activities and your exercise to help you meet that goal. There is a misconception that things need to be stronger. The pelvic floor has to be stronger. Where's your pelvic floor? People point, and I put my hand on my crotch. Your pelvic floor is right here. The baby's on. How is this being strong and tight helping your baby get out? They're like, oh. Yeah. We don't want the weak pelvic floor, right? I have had patients, 5, 6, 7 babies, underlying issues, neurological issues, very low tone in the pelvic floor. And that is a positional challenge, right? Those babies are struggling to tuck their head to get into the mid, but you're right, it's 20 to 30%. I have pulled pelvic floor therapists we refer to and have asked them, what percentage of your practice is comprised of patients who actually have weakness? The answer is 20%, 25%, 30%. So 2/3 to 3/4 seeking pelvic floor therapy are experiencing hypertonicity. Was it any wonder we're spending 4 or 5 hours pushing, 6 hours pushing to function in these tissues postpartum? These tissues were not prepared. Now they've been traumatized, difficult healing postpartum. I attended a chiropractic seminar with someone loved, respected. We tried a new educational offering from this doctor. So much of what they said was fantastic. And there was a blurb about the pelvic floor, the chiropractor's role in educating. The takeaway was recommending Kegels for our patients. I sat there watching chiropractors write this down, and I was like, oh my gosh, no.
Then like on credibility.
It's such a shame. Just so again, like sat there. I'm not going to speak up because it's not my place. It's unprofessional to call her out because she is amazing. Everything else was great. Oh, we did get a survey form at the end, and I left a response. Was disappointed she brought this up because she is not up to date on recent research, evidence-based. I love this class, this doctor. I had supported and taken all her programs, and I this just needs to be removed. She just needs to not say anything about postpartum and pelvic floor if this is all she has to contribute. I think she's right. Chiropractic needs education on this, and that we are in a position to provide education, do some really simple screenings, make referrals for pelvic floor therapy. She needs more education if she's going to be the one to do it, or she needs to bring somebody else in that can speak to this a little bit more accurately. You're going to see these people and they're going to need this. And so here's, we want to try to, be able to speak to it.
Some good relationships with pelvic floor.
I'd rather you say nothing at all. There was somebody speaking about pelvic floor. Awesome.
Well,
It was not a chiropractor. We can learn outside our professions. This happens across the spectrum, not just in healthcare. There can be a hesitancy to learn from providers who don't hold the same degree, but having a depth of knowledge on a topic that goes beyond whatever your school taught you, however long ago they taught you, and how they taught you, is what allows you to best care for your patient. That's one of the things I love about VRM is there's so many different types of people from the birth world represented, even within the faculty. You've got different education, different backgrounds providing this perspective where it doesn't matter what you do or what you learned. Take this information and use it to help your patients, your clients
During your birth, you did a beautiful job of being able to advocate for yourself when talking to a patient frustrated by their healthcare. Do you offer advice? What would your advice be to someone struggling to advocate for their birth and baby?
Self-advocacy is challenging for a lot of people in any situation. I think that in a medical setting, even more so, because if you don't have any type of scientific background, especially with birth, there's so much vulnerability. How many visits are face to crash, not face to face? And the medical model, unfortunately, often is using fear and shame as their tactic. And so I will often ask people as a provider, I can often tell but I would hope that nobody is coming into my office and feeling intimidated. I try to be open, lots of information. Information is power. I want you to understand. Sometimes someone needs additional support, and I ask, where's your partner? Do they feel comfortable speaking up? Are they a good advocate for you? Your doula visit. Maybe it's your friend, right? But they're hearing everything, and then you have this conversation afterward. Sometimes they just need somebody else to just support them, and that empowers them, or they may feel comfortable with them speaking on their behalf. I give them simple tools to find out what's happening at your next visit. Do you know you're getting swabbed for GBF? Why? What happens if it comes back positive? Ask. A lot of people don't know what to expect at visits with their provider. So understanding, ask at your first one, like, how many visits am I going to have? Can you tell me what happens at every visit? I'm like, they're probably going to think you're paying what? They should put that together quickly. Yeah. There probably isn't time for them to ask the question afterward. Even if you can formulate a question, in the 5 seconds you process the information. I know you're in a hurry, doc. You've got to get to your next patient. That's the managed healthcare system. I have a couple of questions. Can I email them? Can your nurse answer them? You deserve every question answered. And your provider's probably not going to sit for 20 or 30 minutes. That's fair. But you still deserve your questions answered. Formulating questions, brain. Ask, what are the benefits? Why do you want to do this? Why are you recommending this? What are the risks? Everything carries risk. Oh, we'll just do a quick brain sweep. Do you know what percentage or likelihood of infection in brains? Yes. Do you understand how light so? Yes. If they're recommending intervention, they need to make you aware of risks. What are my alternatives? I don't like those odds. What else can we do? What are your instincts? If they're explaining this procedure and your guts are churning, like maybe we need to be questioning this, where you can ask for time to wait.
The fetal monitor, the internal one, if a doctor suggests it, I'll like the people, let's figure out what an internal fetal monitor does and how it's inserted and like, well, what happens to you think afterwards? Most of the time they were like, I don't want that.
And then I'm like, what happened to Breech? Nothing. What actually happened? Statistics saying a 50% increase from 0.04 to 0.08. That's not statistically significant. Done this hard to remain calm and do this in the moment. I have patients that like literally write it on your hand or take a Post-it that says what each of those stand for and read off of it. And they'll probably be like, where did you get it? But it is your right to have these questions answered. And it is your provider's responsibility to inform. Nowhere else in medicine is there the implied global umbrella consent like an obstetric. I want to believe everyone who goes into healthcare is doing it because they want to help people. I believe that those OBs are recommending what they believe is best, but you know your background, desires, and goals. Nobody is more invested in the health and wellness of you and your baby than you.
Know your baby better than anyone and can advocate for your baby.
You're not asking questions to put yourself or your baby at risk. You're asking these questions because the provider has not instilled confidence in you that this is the best option. Not everybody questions everything. I am a questioner. I question everything.
Well, I'm getting things following you, and I only know the why behind a decision. And if I can't give the why, my autistic brain just.
But I also have had doctor's visits and had providers where I actually don't have questions because you did a fantastic job. You mentioned the benefits and the risks. If you're feeling fear or anxiety, if it's not an F, yeah, it's an F, no. If you are not like, yes, let's do this, take the time, ask questions, get more answers so that you do feel comfortable and confident, because that's the difference on whether or not you're satisfied with your birth outcome. You now feel informed, empowered, you're involved in decision-making. You're not being told what to do.
Athletics that for getting good and about birth, feeling empowered and supported.
Somebody who has a home birth, and that is just a horrific experience for them because they were planning a C-section, and you've got somebody who, you know, didn't even really get a trial of labor because they had a membrane rupture at 37.5 weeks. There's blood prevalent, and now we're at C-section, right? And it's absolutely medically necessary. And at no point would anyone ever question that that's not exactly how that. Thank goodness we have access to healthcare and surgery. How did the delivery when she came in, right? How did the EMTs handle? How did the 911 caller handle that conversation with that mom who just gave birth in her shower? Right? Not everybody's gonna have the time and the training to do this, but it's one person's dream birth is another person's really bad experience. Yeah. Each experience is so individualized, and the system is not set up to treat you as an individual. You have to advocate for yourself, and it doesn't have to be aggressive. Some people are like, I'm not going to do that. Let's hire someone who can. Tell my sister, talk to your partner. Can we get you a loud doula? Like, you clearly desire this information. A lot of times, the rest of us in the birth world end up filling in the gaps here. There is opportunity for education. A lot of times it's referring them. You're asking about stuff I'm familiar with, but also to my scope of practice to offer guidance. There's this also website called Evidence-Based Birth. They're going to talk about different means of induction, and they're going to give you like just getting them to the place. And then that helps them formulate the questions, right? To go back to their provider. Or we forgot. People come in and are like, yeah, I don't think I ever do the ECV. I'm like, if that's what your gut's telling you, then don't listen to that. Take time, ask questions. If you can't advocate for yourself, that's okay. But you want to try to get somebody in there that can.
Was there anything you did differently in your second pregnancy that did not result in a breech baby than your first? Anything you felt intentionally made a difference?
Yeah, it's a good question. I was more obsessed with figuring out your position. I started doing some pelvic floor educational trainings in that second pregnancy. I still don't think I understood how much my work was impacting that. I was more intentional about movement at home. Stretching once a week isn't really changing tissues. So I'm more intentional about what my movements at home looked like. I did delegate certain things to my husband, back time, crib. They were thinking not doing my body any favors. I was more cognizant of my breath on top of knowing where he was by about 25, 26 weeks. I convinced a midwife to check around 31 or 32. My journey with him is different. Getting your head wedged into one position for 15 weeks isn't ideal. He's had a lot of cranial work, trying to have more awareness about let that be an obstacle. I really did feel like my own tension and some of that stuff had created an obstacle for her. Knowing what I know about the placenta, that may or may not have been true.
So oversized placenta.
I got 60 capsules back.
Anyone wants to contact or resources for breech birth and chiropractic and pregnancy, how can you do that?
So our website is a great resource. Instagram is at Beverly Bliss Denver. My personal Instagram is at Dr. Jaimy. I'm a birth nerd. I can talk about this all day. And quick conversations and questions. Emails always the best because I can answer emails 24 hours a day. I don't, but finding time to jump on phone calls can be really challenging. I've got 2 teenagers and, all the things with running the office. Email is my favorite medium because it gives me flexibility to respond in a thoughtful way in a time that works for me, which means you're going to get a good amount of my attention and hopefully not a long conversation today.
Thank you so much for coming by. I am very happy that we have people out there like you passionate about breech birth and all the long advocate educating you and doing work for the piece for coming on.
Thank you for having me. It's always fun to chat birth. I love there are avenues for education and hopefully somebody who feels more empowered in their journey.